Did you know that a silent killer is claiming twice as many Black lives and hardly anyone is talking about it? All right, let's uncover the truth about multiple myeloma. Okay, guys, welcome back to my channel. I'm Dr. Natasha Ramantal. I want to talk to you about a silent killer that's disproportionately claiming the lives of Black Americans. It's not in the headlines, and most people haven't even heard of it, but it is taking mothers, fathers, and other loved ones away far too soon. Its name, multiple myeloma, and it is a type of cancer. So we're going to get into that. So today I want to talk about multiple myeloma. It is a deadly blood cancer that's impacting the Black community at alarming rates. Now, despite Black Americans being more likely to develop it, they're less likely to be diagnosed early or receive treatments that can actually save lives. So I'm going to break down what the disease is, why the disparity exists, and also what we can do about it. Okay, so first off, multiple myeloma is, as I said, a type of blood cancer, and it actually begins in the plasma cells. Now, those are a type of white blood cell that's found in the bone marrow. And when they become cancerous, they actually crowd out healthy cells and they produce abnormal proteins that can damage your organs, especially the kidneys and the bones. Okay. Now, early on, it might not show any signs or symptoms. So, but when symptoms do appear, they actually include things like bone pain, fatigue, frequent infections, confusion, weight loss, nausea, and kidney problems. And by that, I mean kidney problems out of nowhere. Maybe you don't have a history and your blood work is now showing up with some issues with your kidney. Sounds serious, right? That's because it is. So, one of the things I want to do is to give you some perspective. Black Americans actually make up just 13% of the US population, but over 20% of multiple myeloma cases. That's alarming. Now, and the odds of actually developing the disease are twice as high for Black Americans compared to white Americans. But here's the twist: Black patients often have less aggressive forms of the disease. That should mean better outcomes, right? Unfortunately, it doesn't. Now, because of delayed diagnosis and limited access to care, and health system bias, let's be honest, Black Americans are also twice as likely to die from this disease. Now, that's not biology, that's simply the system failing our community. So, what's behind these outcomes? Well, a few things: delayed or no access to the screenings, racial bias in how pain or symptoms are being interpreted, and also underrepresentation in clinical trials. That's historical. It's based on how Blacks have been mistreated and abused in the US. Historically, as I said, and also systemic mistrust of the healthcare system on a whole. So, even when Black patients present symptoms, they're less likely to be referred or for advanced diagnostics or given the most effective therapies. So, what can we do about it? Well, for one, we can build awareness. Okay. Start with sharing this video, talk to your family, learn the signs and symptoms of multiple myeloma, especially if you have a loved one that's over 60. Ask them about getting screened. Okay. We also need more Black patients, as I said, in clinical trials. We need more Black representation in medical research and healthcare policies that actively close the gap in care delivery. Now, community based organizations and federally qualified health centers, FQHCs, they're doing critical work, but this fight needs everyone. We need healthcare providers, we need researchers, we need policymakers, all of them. We need everyone to step up. Okay. So, my call to action to you and for Black women everywhere is to remember, in the early stages of multiple myeloma, there might not be any symptoms. However, when the signs and symptoms happen, remember they can be as vague or common as things like nausea and constipation or even loss of appetite to something a little bit more concerning like bone pain, especially if you get that bone pain in the spine, the chest, or the hips. Okay. Also, you can look for things like mental fogginess or confusion, fatigue, the infections, like increased infections, weight loss, weakness. Thirst also falls under that, and then the need to urinate frequently. All of that falls under the symptoms for multiple myeloma. Now, I know these symptoms may be seen in many other conditions as well, but as a patient advocate, I'm advising you to make an appointment with a doctor or other healthcare professional if you have any of these symptoms and they worry you. Okay, meaning they haven't been around before, or you notice that they're more frequent, and request to be screened if that's the case. Multiple myeloma may be an overlooked disease, but it doesn't have to stay that way. Okay. If this video moved you, do one thing. I only ask that you share it, because one share could save a life. And also, I just ask that you subscribe for more helpful information, and let's keep pushing for optimal healthcare, one conversation at a time. Until next time, be well.